Okay, so today we're gonna dive into something that could be really useful for a lot of you guys out there. We're talking about the new Canadian dental care plan, and we're even going to be taking a look at how one local clinic, they're called Highbury Park Dental, how they're actually seeing this thing play out in
Yeah.
the real world.
Yeah, that's right. I mean, this
Yeah.
is pretty huge for a lot of Canadians who don't have,
Right.
private insurance for their teeth. So let's jump right in. For those who might not be, totally up to speed, what exactly is this Canadian Dental Care Plan? Or CDCP, as I guess we're going to call it.
Yes, CDCP. So basically, it's a federal thing, right? And it's all about trying to make dental care way more accessible, if you're a Canadian resident. The main thing is you can't have private insurance already, and your household income has got to be under $90,000. So really, it's about making sure people don't have to skip going to the dentist just because they can't afford it.
Yeah, and that's such a big deal. What's interesting to me, though, is how they're actually going about this. It's not just, flicking a switch and it's available to everybody.
Hmm.
So tell me a bit about how this phased approach works and what kind of stuff is usually included in the plan.
Oh, yeah. So the whole rollout thing, that's definitely important. They're doing it in stages, basically.
Hmm.
Mostly it depends on your age and, a couple of other factors. It's worth checking the Service Canada website just to stand up to date on when you're going to actually be eligible. And in terms of what's actually covered, it's a pretty wide range of stuff, honestly. Your regular cleanings and checkups, x-rays, fillings if you need them, even some of the more, I guess, complex procedures like root canals, all that's in there.
Right. So it's not like, just the bare minimum. They're actually trying to cover some of the bigger things that people might really put off if they didn't have help. But it's super important for everyone to understand that even though the goal is to help people get access to dental care, it doesn't mean that everything is automatically like free. Depending on how much your household makes, you might still have to pay some out-of-pocket costs. So the best thing you can do is really go to the Service Canada website, figure out if you're actually eligible, and then what exactly is covered for you specifically, before you go ahead and make any appointments.
Oh, for sure. That's a great point. You don't want to get caught out.
Mhm.
So let's actually see how this is playing out, in real life. There's a local clinic, Highbury Park Dental, and they've actually started taking patients who are using the CDCP. I think it'd be pretty interesting to hear about their experiences.
Oh, totally. I mean, seeing how it works in practice is so important.
Yeah.
So what have their patients been saying about using the CDCP?
Well, there have been some pretty powerful stories. For example, one patient, they were in a lot of pain, like really bad toothache, and they got an appointment super quick. Turns out they needed a root canal, which Dr. Noor was able to do, and it gave them a lot of relief. Then there was someone who hadn't been to the dentist in like years. They just couldn't afford it. But now with the CDCP, they were able to get fillings from Dr. Noor with Anna assisting. I heard they were both really great. Apparently, that patient was super nervous, but they made them feel really comfortable.
Wow, it's amazing to hear how people are getting relief and the care that they need. It's almost like they're finally able to breathe again, knowing that they can take care of their teeth.
Hmm.
Were there any other examples at the clinic that really show how the CDCP is being used?
Oh, yeah, definitely. So there was this one patient, and their dental bridge came loose. It wasn't even their usual clinic, but Highbury Park Dental, they managed to squeeze them in for a same-day appointment because someone else canceled. Lucky break, right? And then Dr. Falguni, they explained everything and helped the patient get a referral to a specialist. We also heard about a patient who just had a ton of questions, and Dr. Suela was really patient, took the time to answer everything without making them feel rushed.
It's really encouraging to see that this plan is being used for so many different needs, whether it's an emergency, or just keeping up with your regular checkups. And I think it really shows how important it is to have a clinic where everyone's on the same page, communicating well and making sure patients feel supported.
Absolutely. So I guess just to sum up, the CDCP, it's a federal program, right? Aimed at making dental care more accessible to Canadians who don't have private insurance. And Highbury Park Dental, they're a good example of a clinic that's actively using the plan and, actually helping people get the care that they need. We've heard stories about how it's already making a difference for folks dealing with both like immediate dental problems and those who just need to stay on top of their dental health.
Yeah, and all of this really brings us to a key takeaway for all of you listening. Understanding how the CDCP works and seeing how local clinics like Highbury Park are working with it, that could be a really important step for you to start thinking about. It's about taking control of your dental health without worrying so much about the costs. So I guess the question now is, what questions does this all raise for you? Are you eligible? what kind of options are out there for you. I mean, it's definitely worth looking into.
Yeah, absolutely. Thanks for breaking it all down. And to everyone listening, make sure to check out Service Canada to see how the CDCP might work for you. And we'll catch you in the next deep dive.
Peace out.